Dr. Larry brings you another segment of Did You Know?
We've all heard somebody say, I've got a bad hip, knee, or spine. Or maybe we say it about ourselves. In addition, commonly in healthcare, there's a lot of chit-chat about that. We ache as we age and our joints begin to rage. And eventually, at some point, many of us will have to address some type of bone and joint issue, and you may hurt so bad you need a Kleenex or a tissue. Or maybe you're the weekend warrior or athletic type, and after many years, you know that noise or pain in your body just ain't right. So where do you go for a joint that's screaming no? Well, it's a field of choices, but when it comes to choosing an organization of doctors for something as important as, let's say, sports medicine, you want to pick a facility that has its processes and people operating to win. Because it's the style of this next organization, OSMS, that separates them from the rest. They are doctors who not only own their clinic, but actually focus on the patient. So pay close attention to our next guest. He's a practicing physician, board certified in a field of bone, joint, and muscle care, and he specializes in guided joint injections, bracing, and catch this, regenerative medicine, which will be the main focus of our two-part show starting today. So for the sake of simplicity, we'll call this segment Ask OSMS. Dr. Harper, welcome to the show.
Well, thank you for having me. I'm excited to be here.
Both of us, because anytime you throw sports medicine in front of something, and then you're talking to a doc that does it, and then you add in guided injections and regenerative medicine, and kind of everything you do, it's just one of those things that I think piques all of our interest because of how it plays out in life, whether we're young or we're old, etc. Like I said at the monologue, weekend warrior type. But I'll tell you what. Before we get into that, why don't you just give us your full name, your license type, and your board certifications?
Yep. So Michael Harper, I'm an MD and I'm board certified in physical medicine and rehabilitation, as well as I did a fellowship and board certified in sports medicine.
And you practice at OSMS, but where are the locations that you practice out of?
Yep. So currently I'm practicing in our Green Bay location.
And I always jokingly say we're 2 hours away from Green Bay in Iron County, but it's like being in our backyard. People love to go down to Green Bay and travel down there. And every time I have to send people down to OSMS, I'm like, it's in Green Bay. Like, oh, yeah, it's no problem. I go down there all the time. So it's, folks, he's right there in Green Bay. They have multiple locations, but that's where Dr. Harper is at. And why did you choose to practice at OSMS? I mean, there's facilities out there, there's hospitals you can go to, but I always like to hear the different answers on this one because I think the uniqueness of how OSMS is set up is what actually does stand above the rest. So what made you choose to practice at OSMS?
Yeah, absolutely. Yeah, that answer is twofold. One is originally from Wisconsin, so I'm originally from the Madison area. My wife is from De Pere, and so we're looking, after I finished my fellowship in New York, to come home back to Wisconsin. And with targeting an area, she wanted to be close to her family, and so we're looking at northeastern Wisconsin. And with talking with the various healthcare groups that are in the area, OSMS really just stood out, particularly because it's doctor-owned. One of the things about it being doctor-owned allows us to be patient-focused and really focus on having the best patient care possible. And with it being, we're large enough that we have good access, but we're small enough that we're fairly nimble as well, that we can adapt to some of the changes and improve patient care as new things come out relatively quickly. And it kind of takes away some of that red tape that some of the bigger hospitals do have.
Excellent. And folks, I visited the facility 6 months ago. And when I first came in, the first thing I noticed was that the staff, when you meet them, they're all standing up. And then when I got back and met some of the other physicians there, one of them said, it was Dr. Schekinger. He said, yeah, actually, we decided to do that because we all went through kind of how patients flow through the office, and we thought that might be better. It looks like they're up and ready to meet patients. So that's kind of what Dr. Harper's talking about. It's these little kind of nuances that they can really iron out, red tape, as he said as well, too, that just makes it very efficient for patients. And I've used your acute care clinic before for patients with a shoulder injury, seen by a physician right away. And they really do. And so these docs have an interest to make sure that they have the full suite of available services for you, but also make sure that it's a seamless process as well. One thing that I just get a kick out of, and I think that's just kind of gives a little insight to you as a person as well too, because that's what the bottom line is when patients come to see you, they always kind of like, so what's your favorite food, what's your favorite hobby? But I always like to ask, what is your one unique personal talent or hobby or interest? What would kind of jump out that we would all like to know about you? I'm interviewing Dr. Michael Harper from OSMS. We are getting a good dose of info on this musculoskeletal pro who treats you non-operatively with issues from elbows, hips, shoulders, or even banged up knees. Let's roll it. What is your one unique personal talent or hobby or interest? What would kind of jump out that we would all like to know about you?
Yeah, well, so some things that people don't know about me is when I was in medical school, I was part of our a cappella group. So as a bass singer there, and then recently I actually just joined a choir that it's a parent choir for our church. And so that's one of the things we're working on practicing. We're doing that Monday nights now and trying to get ready. I think we're probably going to do our first mass in about 2 months here now. But it's a bunch of parents that are getting together that have an interest in singing. And it's been a fun time.
Oh, that's great. And that's I love. That's why I love to know and ask that question. A cappella. So I've got kids that play guitar, but I can't quite get them. Mm-hmm. They're starting to sing, a little bit, but you have no issues or problems singing a cappella, and you did that through medical school as well too. That was kind of when you picked it up, or you picked it up before that, or?
Yeah, so I sung in high school. I was in our choir. I was also in our band. I was a tuba player. But then didn't do a whole lot of singing other than when I was in the pews at Mass there in college. But in medical school, one of my friends was joining the a cappella group, and she encouraged me to join as well because they needed some more male singers. So I agreed, and it ended up being a lot of fun.
Yeah, stepped up to the plate. Fun. Nice little, diversion from the week and a little talent. Well, thanks for sharing that with us. And so that kind of leads us into just kind of the main meat of the show here is, I would like you to generally explain for all of us what interventional sports physician does and what a physical medicine and rehabilitation physician is and does. Because there are some similarities in certain disciplines, but then there's some differences as well too. So if you could just kind of help us understand what the sports medicine physician does and the PM&R physician does as well.
Absolutely. So sports medicine really is focusing on the musculoskeletal system. And not every one of my patients is a quote-unquote athlete. Some are just people that want to be more active. And so focusing on treating joint issues, tendon issues, ligament issues, and being able to get them feeling better and improving their function. And that's really actually leads into physical medicine rehabilitation. And that's a primary specialty that you do after medical school. It takes 4 years to get that done. And the main focus of that one is also improving function and being able to get people to improve their quality of life. That base training kind of takes you through, we have a lot of musculoskeletal emphasis, but it also talks about other individuals of how we can rehab them of becoming more functional in their life, whether it is they suffered a stroke or a spinal cord injury or an amputee. And so it really blends into well as far as having that base training in PM&R of improving function to then focus really and hone in on the musculoskeletal system with your sports medicine.
Excellent. I'm glad you said that too, because I think it can be a little bit not misleading, but something that needs clearly defined too. It doesn't mean sports you have to be in a sport, play a sport, do a sport, but it could be just somebody that's a 35-year-old person playing basketball, or you're playing volleyball in the backyard with your kids or something like that, and potentially have an injury, or not even necessarily sports are related as well too. The point is kind of the umbrella is the musculoskeletal side of things, and that's kind of the main focus, which it's kind of interesting talking to different physicians about their emphasis and specialty and why they chose the direction they chose, because like in certain primary care settings, I know I've talked to primary care physicians and they'll tell me, like, Dr. Lee, honestly, I don't know much about the muscle bone joint system. So, I kind of default that to other things as well too, where here you had an emphasis and a focus on that. Was it something that kind of carried you through? Like, you mentioned singing, but were you into sports, kind of big time, not so big time, or is it just kind of something you found interest in as far as a focus in a study?
That's a great question. So I was a specialist of the injured reserve throughout in high school. So I was a three-sport athlete, football, wrestling, and track. But pretty much every season, all 4 years, I was spending time with my high school athletic trainer, John, rehabbing from some sort of injury, whether it was a broken collarbone, I fractured my knee, I also had a mallet finger, some hernias, etc. So through all of my injuries, really spiked my interest in sports medicine, and I got exposed to the field of athletic training really at first. And he actually inspired me. I did my undergraduate degree at lacrosse in athletic training, so I became a certified athletic trainer before medical school. So for many years now, my kind of path has been pointing me towards musculoskeletal care as well as sports medicine.
Did you say you're an injured reserve specialist today? Did I catch that right?
Yep. Yeah.
You took that in there at the beginning. I was smiling back here. I was like, I gotta come back and ask it. So some bang up and hang up. So, you were predestined to do this. This wasn't because you hit me oblique with the singing. I'm like, okay, I'm gonna circle back around because it's I got to figure out where this came from. But doesn't mean you had to be an athlete. I just wanted to know. But no, you had the ground was being laid early on and piqued the interest. Okay, so. One thing too, now that we're kind of highlighting this, how would a patient know? Because I think you work with a bunch of orthopedic surgeons there, but yet your focus is on what you just said. Kind of, I'll use this term, functional medicine, as far as that goes, but that's just my term. But from the physician side of things, how would a patient know, to choose, okay, I've got this problem. I tweaked my Achilles. I torqued my knee. Maybe it doesn't seem surgical at this point in time. As far as triaging a patient, people are listening to you right now, how would they know which to choose first? What decision comes into that play?
Yeah, and so kind of how I coined myself, I'm a non-operative specialist, and so if somebody needs surgery or is looking for a surgical opinion, absolutely need to see one of our orthopedic surgeons to get that side of their care. But I kind of have focused my practice on everything up to surgery. And so whether it is just doing physical therapy that needs a referral, whether there's medication optimization, different types of bracing, and then ultimately these interventions, both ultrasound and fluoroscopic guided interventions, can really help individuals and keep them out of the operating room.
And that's a question because for what I do as a chiropractor, that's when something comes up, like today I was working on a frozen shoulder, bone, joint, neck issues, etc. But when it comes to the point where I'm like, okay, we gotta move this along. I need to make a referral. You got to see sports medicine, orthopedic person. That most of the time, the first question out of their mouth is, "I'm not going to need surgery, Dr. Larry, am I?" And I'm like, I don't know yet. So it's an I don't know question mark. But I know that right now we've got to move this along. Let's get you referred in and get you seen. So you kind of hit the nail on the head as far as that one goes. As a non-surgical specialist. So folks. If you're looking essentially for, a musculoskeletal injury, or you have one, I should say, and you're looking for a specialist, but you're like, I just want to make sure that I can do this without surgery at this point in time. Dr. Harper that's his main focus. And, which almost answers the next question. I would say at some point, if you've maximized care based on your differentiating factors, how do you collaborate on cases then with different physicians or orthopedic surgeons, for that matter, or even spine surgeons?
Absolutely. Yep, and that's on a daily basis, I'm going and talking with my other orthopedic surgeon colleagues, and we share patients back and forth. And multiple times, I help them also, and their patients, that they're trying to differentiate, is their pain coming from the hip or the knee, and they ask me, can you do a diagnostic injection to confirm which the primary pain source is? So I use that image guidance to help confirm that the pain is coming from a certain location. But also for me, that if I have a case that somebody's not getting better with non-operative care, and we do see something anatomically that can be fixed with surgery, that they're readily available just down the hall. And many times that if I see somebody and they're considering doing surgery, I can even go talk with one of them, and then maybe even get added on same day that they can talk with the surgeon too, to get that consult as well.
Okay, neat. So it's a back and forth collaboration there, and and it almost would seem like like you said, if something where somebody ends up calling one of the orthopedic surgeons first, and they're like, "Hey, yeah, no, this doesn't need surgery," you could you're that workhorse there with the diagnostic stuff. And I would imagine, and correct me if I'm wrong here as well too, with your type of specialty, my guess is you are more into, like, you'll see a patient, treat a patient, follow up, and then you're kind of in that mode of almost like a hybrid sort of physician that you'll do a treatment, follow up, and then when the case is satisfied, my guess is probably not closer follow-ups, but I guess I'll probably say take it out of like a physical therapist book. So somebody comes in and has a hurt shoulder, the physical therapist works on them 2 times a week, 3 times a week for 4 to 6, 6 to 8 weeks, and then they conclude the care and do a post evaluation. Is that kind of something where you're following cases all along the process? You'll do your procedures, and then you do follow-ups, and then do reevaluations, and then do assessments, and if they need a referral or not. Is that kind of how your practice works? So yeah, just touching on that for just a moment too, and referring patients to OSMS for many years now. That's how these guys work. They'll be down the hallway, talk to each other. In fact, when we got off air, he said, "Yeah, just today had a couple of the orthopedic surgeons come to me and say, 'Hey, can you do some guided diagnostics for me?'" And then so he jumps in and does that. So they're just kind of bouncing things back and forth between each other, of course, when they have their own patient load as well too. So one of the unique qualities, and it's kind of neat to see just from the front end to the back end, and then when I made a visit down there as well too, met about 6 to 8 of them as well. They're all kind of about the same demeanor. They're just they're there to figure out how to make a better experience for you as a patient. They, by the way, get it when it comes to institution-based care, how things can be red taped for you. There can be long delays, and you'll see some of the reviews on Dr. Harper. I'm going to review a couple of those at the end of the show. Just one of the comments is that how speedily they can get things done. They also have an urgent care as well. I know it's 2 hours away, but from, I think it's 9 to 5 or 8 to 5. You can look on their website. But if you have an injury of some sort and you feel like, hey, I got to get this taken a look at now as far as that goes, you potentially may have a fracture or whatever, they've got an urgent care that's opened Monday through Friday, and you will see one of the orthopedic surgeons as well too. So they've got just a full suite of services on the referring side of things. Obviously, I deal with a lot of the same cases they do, and a lot of you utilize me as kind of the lead-off hitter. Okay, Dr. Larry, can you fix it, or what's going on? And so when it gets to the point where I've got to tee up referrals, I'm always looking for the best around. And from front end to back end, they're great. When there's been some issues where I've had to circle back around and say, hey, look, let's do a little tighter follow-up, or I got to ask you a question about the case, they're instantly to get back to me. I've got a point of contact over there who gets back to me, and then some of the physicians as well too. We have each other's phone numbers, so we've had to collaborate that way as well too. So it's a nice bridge locally here between my office and their office, just as far as being a referring provider as well too, and it's worked out real well to triage local patients. And not everybody needs to make a trip, but I'm rattling off 5-10 cases right off the top of my head right now too. Like I had a lady, she injured her knee out of town, had an x-ray, they said it was negative. I evaluated it, said I'm not quite sure if I like that interpretation, sent her down, and turned out she had a fracture in her knee. So that's kind of the stuff that we go back and forth. We had another case, a guy tweaked his knee, and one of the orthopedic surgeons says, you know what, I don't think he needs surgery, and have Dr. Larry do some rehab in the office for it. And it's exactly what we did, and the patient did well. So again, good back and forth. The reason why this Dr. Harper interview is important, he is the non-operative specialist. So he's the guy that you see that gets you up to the point of surgery. And he's got a lot of tricks in his bag as far as that goes. We're going to dive into that coming up here in the next part of the interview. So sit tight. Again, it's a 2-part interview. So I'm teeing you up, warming you up. It's going to be this week and next week. And we will get into ultrasound guided and radio frequency. What do we have? I don't know. I can't remember if we're getting radio frequency, but I know we're going to get in that regenerative medicine at some point as well too. So sit tight. You're listening to the Dr. Larry Radio Show on WIKB. We'll be right back.
We'll be right back with Dr. Larry.
Dr. Harper and I are discussing how you can have a successful injection for some of your bone, joint, or muscle ailments or injuries. But before we dive into that, here's a couple of, we all like looking at Google reviews, so I cut and paste a few as well, too. Dr. Harper is very knowledgeable and personable. He thoroughly reviewed all of the options regarding treatment for my knee. The procedure that he performed went smoothly and has helped tremendously. His staff was also very kind and courteous. Next one, first time, my 90-year-old mom. I wonder if he's saying a cappella to the 90-year-old mom. So he's got the grit of an athlete and the voice to talk to 90-year-old moms. And he listened and took action. My mother thinks he's cute. Reed, that's something I get asked. I just got asked that about, who was it? I can't remember. I think it was Dr. Bruning. Somebody says, one of my elderly ladies comes in, well, is he cute, Dr. Larry? I go, now, what does that have to do with his technical skills? So we started laughing about that. But so this lady said that as well, too. She had pain in her arm for 1 week at a level 10. Now she's so happy at a 0. So there you go. There's a little couple reviews of Dr. Harper there on Google. But let's jump back into this other part of the interview, and let's hear how Dr. Harper talks about his specialty. Roll it. Is that kind of something where you're following cases all along the process? You'll do your procedures, and then you do follow-ups, and then do reevaluations, and then do assessments, and if they need a referral or not. Is that kind of how your practice works?
Yep. And so, many times if we're doing a injection for both diagnostic and therapeutic reasons, that we'll follow up closely. And normally it is that I want to hear back from my patient within 2 to 3 weeks after an injection to determine, did that help or not? If it helps, great, fantastic. If it didn't help, then we kind of reassess, well, what's our plan B? What's our next step? How else can we help improve their pain and help improve their function? And so we do have that little bit closer of a follow-up, just making sure we're on that right track. Excellent.
Which kind of dives us right into this stuff that I think is absolutely fascinating. And people and patients are definitely interested in this. It's a topic that comes up all the time, especially when they see a physician like yourself, is if they have one of your procedures or techniques, it's like a hot topic. Like they're talking about, oh yeah, the doctor had me in, this is what we were doing. He did something where I think they did a guided injections, they always call it. They get excited about it. So I'd like you to begin to overview some of your sweet spot techniques you like to use. And if you could just explain and describe to us what an ultrasound guided injection is. And you can also add in anything else you might want as well too, if you do like flip it over to how you use it for a diagnostic as well too, just to kind of help us understand why you use ultrasound, what it's good for, maybe 1 to 3 benefits, and then also from a diagnostic standpoint as well too, because I think they both kind of work hand in hand sometimes.
Absolutely. So ultrasound guided injection, so it utilizes an ultrasound, and so how it generates a picture is using sound waves, and very similar as if a woman is pregnant, going to their OB, getting a picture and seeing the baby. I use that to see the musculoskeletal system, and it really helps me identify where the target structure is and be able to do that injection safely and effectively. And so we use this ultrasound guidance to target many joints and as well as tendons and different nerves throughout the body, and be able to have a successful injection. Our goal when we do these injections is to hopefully improve somebody's pain, improve their functioning, and ultimately their quality of life. And some of the benefits of having image guidance is, one, confirming the medication goes into the right spot, that we're getting it precisely where that target tissue is. Another one is that it's safer, and we can see if there's a vital structure nearby, such as a blood vessel or a nerve. If that's not my target, I want to stay away from that. And the ultrasound helps me visualize those structures to stay away from them to make sure I can perform that procedure safely. Additionally, there's times I do an injection for a carpal tunnel, which is your median nerve. And while we want to be near that median nerve, I don't want my needle to go through the median nerve because that's going to be very painful for the patient. And so that ultrasound guidance helps make sure I get the medication right next to it, but I don't actually touch the nerve itself. And ultimately, it kind of leads to is that the procedure ends up being better tolerated when utilizing an image guidance, that they have better procedural comfort during the procedure.
Excellent.
Ends up being less painful.
Yeah. So, okay. So you use ultrasound, but you also do carpal tunnel injections as well. Is this something that where somebody has carpal tunnel syndrome, they're exhibiting signs and symptoms, you've proved that it is, and maybe they're just short of a candidate for surgery as far as that goes, for carpal tunnel release, then you do guided injections for carpal tunnel as well?
Correct. Yep. And so for multiple conditions, and one of them is carpal tunnel, that if we have identified that as the diagnosis, doing injection around that area can really help. And especially if somebody's not ready for surgery. And so there's times where, like, yes, you're a surgical candidate for carpal tunnel release, but it doesn't work within their lifestyle and their timeline right now. They can't take their time off of work or et cetera, that we can temporarily help with some of the symptoms with the injection.
Okay. What about something like, same thing as like decor veins? Oh, decor veins, Reed. Spell it. Well, we're going to find out about that next week as well, too. That was part 1 of 2 of my interview with Dr. Harper. Already we are picking up some great facts and insight about guided injections. In part 2, we'll be diving more into the types of conditions he treats non-operatively with his procedural expertise. One of which you just heard is decor veins, and translation in English is just a painful, not just, but it's a painful condition that occurs when the tendons in the wrist at the base of the thumb become pinched or constricted. It can be caused by simple tasks like lifting groceries, laundry basket, or a baby. Or like I had a guy come in from one of the manufacturing areas from Iron Mountain, but his thumb was all lit up, and he had this as well too. Huge, red, painful guy that needs to use his hands every single day, and he had decor veins, and we're going to dive into that type of treatment. Symptoms, just real quick too, I'll let you know, are pain near the thumb at the base, swelling near the base of the thumb, difficulty moving the thumb, sticking or snap and go sensation of the thumb, pain that worsens when you use your hand and that radiates from your wrist into your thumb or forearm, worsens when gripping, and also cause some weakness and numbness as well too. That's what that is. We're going to dive into that next week. And cliffhanger, I just told you it's coming, regenerative medicine. And there's one thing that he talked about in the interview where they're treating something differently than they used to when it involves regenerative medicine, something that's now an alternative to a steroid injections. And I know a lot of you have had those or know about them, and overall pretty comfortable getting them, but there's always that reservation is how many can I get? And he tells me in the interview about a very common complaint that people have in their upper extremities. Not going to give the answer. And what they use regenerative medicine for as well. And just to review, Dr. Michael Harper is a non-operative sports medicine and orthopedic conditions such as knee, shoulder, hip pain, neck, and back pain. Found out, too, he does guided spinal injections. I actually didn't know that. And treats ankle sprains, tendon disorders, osteoarthritis, and uses ultrasound and fluoroscopy, and radiofrequency ablations, joint injections, and regenerative medicine as well. You heard how you have to call or how you triage a call. So if you're looking for non-operative answers and have some of those conditions, then by all means, Dr. Harper is available at OSMS as well in Green Bay. And here's another nice little Google review for him. My first visit with Dr. Harper last week was with severe hip and groin pain. And here it goes. He did an ultrasound guided injection. He was very kind, and was told to take 2 to 3 weeks for the injection to take full effect. She's still a little sore, but the injection is starting to take care of her pain. So again, he told me too, he does it 100% of the time using the ultrasound or fluoroscopy as well too, to kind of see where he's going. That includes anything from the wrist, which can be construed as a fairly simple injection, to a shoulder as well too, but he likes to use guided injections for everything. So I found that is a very unique option that he exercises for folks.